Hey YouTubers, this is Guardian Mike, and we're here with, again, with Mr. Bippus, John Bippus, from what city?
Three Rivers.
And you're the former president of the Michigan Guardianship Association, and you have a lot to provide, and we're going to do some videos on him later on about real estate, property, and forming community. Community is important. Remember how I told you folks on scaffolding, community, surrounding yourself with caring people? He's an expert about surrounding people with caring people, surrounding individuals with caring people. We're going to come back to Charlene Tope, and Miss Tope, I want to ask you about end of life. What can you tell us about full code status? What does that mean? And then take us from there to evaluating, is it appropriate?
Essentially, when a guardian is appointed, they normally tell hospitals, doctors, the facilities that deal with the court-appointed ward that they are a full code status. In other words, everything that can be done to prolong that life in order to return them to a basic, healthy state of mind needs to be done. So the facilities that deal with you on a regular basis, the doctors that deal with you on a regular basis, they need to know if you want to be full code status or not. And then as you enter into end-of-life decisions, you need to consider, do I want my ribs broken when the firemen come and compress my chest, or when the ambulance arrives at the nursing home or the adult foster care home? When is it appropriate to say, let's lift that full code and make them a do not resuscitate? And there are even degrees in that protocol that you can examine and make sure that the facility is aware of what the wishes are. And then there's end-of-life decisions. So normally you would go to the doctor and have them write you a letter saying, this is what end of life looks like, because we're not going to be able to return this person to the stable environment, the stable person that they were. Life is slipping away, and it's time perhaps to not put any precautions in place, but let nature take its course.
Can many of these things take place in a care conference? If they can, I'd like to follow up with a 2-minute video on care conferencing, approaching care conferencing. Can we discuss these issues at a care conference?
Absolutely.
Can you have strangers, say like Mr. Bippus, come to the care conference and advocate for you?
Absolutely.
We're going to fade to black. We'll come back up with our next